What comes to mind when you hear the term erectile dysfunction? Is it a condition only older men suffer from? Or perhaps you think it's all just in the head? Erectile dysfunction, often shortened to ED, is a topic shrouded in myths and misconceptions that can cloud our understanding of this health issue. Let's take a moment to debunk some of the most common ones. Firstly, the belief that erectile dysfunction is a natural part of aging. While it's true that the likelihood of experiencing ED does increase with age, it's far from an inevitable part of the aging process. Men of all ages can and do experience erectile dysfunction, and it's important to understand that experiencing ED does not mean you're simply getting old. Secondly, the misconception that ED is purely psychological. While stress and other mental health issues can indeed contribute to erectile dysfunction, they are far from the only causes. In fact, ED is often linked to physical health conditions like heart disease, diabetes, and high blood pressure. So it's not just all in the head as some may believe. Lastly, the notion that only men with certain health conditions can suffer from erectile dysfunction. This is simply untrue. While certain conditions, like the ones mentioned earlier, can increase the risk of ED, it can affect men who are otherwise in good health too. Lifestyle factors such as smoking, heavy drinking, or a lack of physical exercise can also contribute to ED. These misconceptions can prevent men from seeking help and getting the treatment they need. By believing that ED is a natural part of aging, purely psychological, or only affects men with certain health conditions, we're creating barriers to treatment and understanding. It's time to lift the veil on these myths and start a more honest conversation about erectile dysfunction. Because the truth is, ED is a common condition that affects many men, and it's nothing to be ashamed of. Now that we've debunked some common myths, let's dive into what erectile dysfunction actually is. So, what exactly is erectile dysfunction? In medical terms, it's a condition that's characterized by the inability to achieve or maintain an erection that's firm enough for sexual activity. Now let's delve a little deeper to understand this better. Erections are all about blood flow. When a man becomes sexually aroused, nerves send signals to the blood vessels in the penis, causing them to expand or dilate. This increased blood flow results in an erection as the blood fills two inner chambers in the penis called the corpora cavernosa. The erection lasts until the man is no longer sexually aroused, at which point the blood vessels contract, decreasing the blood flow, and the erection subsides. So when we talk about erectile dysfunction, we're essentially talking about a disruption in this process. And this disruption can occur due to a variety of factors, which can broadly be classified into three categories: physical health, mental health, and lifestyle. Physical health conditions, particularly those that affect the heart and blood vessels such as high blood pressure or diabetes, can impede blood flow, making it difficult for an erection to occur. The same goes for neurological conditions, which can interfere with the nerve signals necessary for an erection. Mental health plays a significant role too. Conditions like depression, anxiety, or stress can interfere with the brain's ability to respond to sexual arousal, thus leading to erectile dysfunction. Lastly, lifestyle factors can also contribute. Unhealthy habits like smoking, excessive alcohol consumption, lack of physical activity, and poor diet can all negatively impact blood flow and overall health, leading to difficulties in achieving or maintaining an erection. In short, erectile dysfunction is a complex condition that involves an intricate interplay of physical and psychological factors. It's not just about not being able to get it up. It's about understanding the underlying causes, which could be indicative of more serious health issues. Understanding what causes erectile dysfunction is the first step towards finding effective solutions. We've understood what erectile dysfunction is. What causes it? The causes of erectile dysfunction are as varied as the individuals it affects. It's not just one thing, but a complex interplay of physical and psychological factors. A range of health conditions can contribute to erectile dysfunction. Diabetes, for instance, can damage nerves and blood vessels, impairing blood flow to the penis. Heart disease, too, can limit blood flow, making it difficult to maintain an erection. Obesity is another risk factor, as it can contribute to vascular disease and diabetes, both of which can lead to erectile dysfunction. But it's not just physical health that's important. Psychological factors play a significant role too. Stress and anxiety, whether it's about work, relationships, or money, can interfere with the brain's ability to trigger the physical response needed for an erection. Then there's lifestyle. Unhealthy habits like smoking can damage blood vessels, reducing blood flow to the penis. Alcohol consumption, while often associated with relaxation and libido, can actually inhibit sexual performance when consumed in excess. And let's not forget physical activity. Regular exercise helps maintain healthy blood vessels and reduce the risk of developing conditions that can lead to erectile dysfunction. While these factors increase the risk, remember that erectile dysfunction can affect any man, and it's nothing to be ashamed of. It's a common condition, and understanding the causes is the first step towards finding a solution. The good news is, erectile dysfunction is treatable. There are several options available depending on the cause. Let's delve into some of these treatment options. Firstly, lifestyle changes can have a significant impact. This might involve adopting a healthier diet, getting regular exercise, quitting smoking, or reducing alcohol consumption. These changes not only improve overall health, but they can also help increase blood flow and improve erectile function. Counseling or therapy is another avenue to consider, especially if stress, anxiety, or relationship issues play a part in the condition. Mental health is just as important as physical health when it comes to sexual well-being. Medication is commonly used to treat erectile dysfunction. There are several prescription drugs available that can help increase blood flow to the penis, resulting in an erection. It's important to note that these medications should be used under the supervision of a healthcare professional, as they can have side effects and may not be suitable for everyone. In some cases, surgical interventions may be necessary. These can range from vascular surgery to improve blood flow, to penile implants for more severe cases. There's also a variety of assistive devices like vacuum erection devices that can help achieve an erection. Remember, there's no one-size-fits-all solution. Speaking with a healthcare professional can help you find the most effective treatment for you. Before we wrap up, here are the key points to remember about erectile dysfunction. This condition, often simplified as ED, is a persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. It's not just a part of aging but a medical condition that can be caused by a variety of factors. These can include heart disease, diabetes, hormonal imbalances, and even psychological issues like stress or anxiety. It's important to remember that ED is not a reflection of your manhood or value, but a health issue that millions of men face worldwide. The good news? There are numerous treatment options available, ranging from lifestyle changes and medication to more advanced procedures. Always consult with a healthcare professional to determine the best treatment plan for your individual needs. Erectile dysfunction is a common condition, but with the right information and medical guidance, it can be effectively managed. Don't let misconceptions hold you back from seeking the help you need.